type 1s do fasting and, exercise and do it safely. And also they can do, I know they can, but please, we need a confirmation from you if type 1s also can fast and do keto.
I just want to say first, whatever I'm saying is more, opinion, and I'm not giving specific medical advice to anybody. Type 1 diabetes is controversial in the medical community to be low carb for one simple reason, that is a misunderstanding what ketosis is versus ketoacidosis. So type 1 diabetics are prone to develop something called DKA, diabetic ketoacidosis. It's a life-threatening condition. You can end up in the hospital. You can die from it. I've treated many of them. But that's a condition where, so your body doesn't make insulin as type 1 diabetic, but you eat bad, so your glucose running wild, and there's no insulin to shove inside the cells, and then you're starved inside the cell, so you start breaking down fat and have high glucose, very high, very low insulin, and then you have that ketoacidosis is a very high level of acid level in the blood, and then when the pH acid level drops, which is more acid, you can shut down organs, damage cells, a lot of things, and it's a very deadly condition. That's different than ketosis. Ketosis is simply a state where you're using fat for fuel and you have ketones as a byproduct, which you can also use as fuel for your brain, for your heart muscle. Completely different processes. So
different things,
understanding that. And so if you have type 1 diabetes, you just have to be a little bit more careful because you will always require insulin. Insulin is vital. But needing 15, 20 units of insulin a day is different than eating bad and needing 200 units of insulin a day. So this is where intermittent fasting, low carbohydrates, you're no different than any other person, except your insulin, instead of you making it and secreting it, you need to give it to yourself. So the idea is you're not going to go zero insulin, but you're going to be very insulin sensitive, or you only need, I don't know, Nayiri, how many units of insulin do you use a day?
It was 10 units yesterday, and I was so pleased with myself for the whole day.
It's amazing. 10 units, some diabetics use that with like a snack. They take 10 units of insulin. So you're taking, I assume, basal insulin, so because you're not eating carbs. So you just need basal level of insulin for body functions. Insulin is vital. So don't misunderstand me. You need insulin, but too much insulin is the problem. So yes, as a type 1 diabetic, you can improve your lifestyle. You should do it with a doctor's supervision because it's going to require, changing the dose of your insulin. Because if you can die if you drop too. So if you, let's say, you're type 1 diabetic, you used to be on 50 units of insulin. All of a sudden, you're excited. You're doing intermittent fasting and low carb, and your glucose crashes. You don't adjust your insulin. You can go into a coma and die from very low glucose level. So in the short term, the low number are more dangerous. So it's very important to do it with doctor supervision because it takes a transition. You may have to tolerate higher numbers until you figure it out. And if it's slow, you do have to take sugar as an emergency. So it's a completely different game. But once you get to somebody who's experienced, you can live your life on a low carb, intermittent fasting, and require very little. Because you can be type 1 and develop insulin resistance. So if you're type 1 and you're overweight, you already develop type 2 on top of type 1, if that makes any sense. Like you became insulin resistant.
And then
and then
so I had
insulin to have the same effect. So you use like a double one. You don't make insulin, but you're also insulin resistant. That's the worst combination. And type 1 diabetes, they go blind, they lose limbs. Because you get them at a younger age, so you have longer time of damage. But you can live a healthy life with minimal insulin.